Oxygen is 97. Do you have any allergies?
Nope.
Latex or metals?
Nope.
Okay.
I don't eat too much metal, so I'm not sure.
Good to know.
If you come into contact with metals, do you have an allergic reaction? Okay, great. All right, so what I'm going to do first is I'm going to try some trays in your mouth just to make sure that they fit around your teeth, because the impression material is going to go inside of it, and I need to get a good form around your teeth. All right, so if you'll open for me. Ooh, tori. Don't bite down. Okay, great. I ask that you don't bite down because you have that bony structure that's under right next to your tongue. That's your body's defense by building up extra bone to add stability. So I'm going to make sure that I don't press down too hard, so I don't want it to scrape it. Okay? So if you open, I'm going to try the top one. You have some great looking teeth, by the way. All right, so I'm going to place putty inside the bottom tray first. We're going to get started with that. Just because it's easier for me to do the bottom first.
Okay.
Now, the bottom one will make you drool. Great stuff, right? You make you drool here. So I'm going to put a bib on you, and then I'm going to hand you a paper towel. And I promise you, I will let you brush your teeth and floss after I'm done.
Okay.
Just because it gets stuck between your teeth. There you go. Okay. There you go. So I'm going to put on a mask because we're going to be up close and personal here.
No problem.
And what they say in the dental office is because we're up in your grill. So, yes, it is a caulking gun. This material will last a couple of minutes in your mouth.
Okay.
But the great thing about it is that it's reusable material. So when we take impressions like this, if you need whitening trays or need another appliance, yeah, I'm coming out. Lift up your tongue, stick it right out at me, and go back in. You can put it back in. This material, we can pour it up over and over and over again. Well, Joe, I was hoping to make you drool today. Still a little squishy. Great job. gave me a great impression. I know, corny dental jokes. So you got any plans for this weekend, Joe? Father's Day
We're
plans?
heading to that, in-laws,
Ah,
actually, this afternoon,
where's that at?
in Houston, or the Woodlands area.
Oh, yeah. One of my dear friends from high school, well, actually, I've known him since 3rd grade. Him and his wife lived down there. It's a nice area. Okay, so if you'll lean your head back for me, I'm going to place this material on the back molars here. You can relax your cheeks for me. There you go. I'm going to place this here. Great. Say hello to the camera, Miss Lisa.
Oh, hello. I noticed that earlier. I came here to grab something.
I'm going to take this out. Perfecto. Great stuff, right?
What was the extra stuff for?
Well, sometimes when I'm placing that purple material, I tend to get a little bubbles, okay? So this yellow stuff actually just, since I'm squirting her directly around the tooth, and you can see the point on that one, it's going around the tooth, which would give it a good seal, okay? I just want to make sure that I'm doing a good job, so I don't have to do it over and over and over again.
Good.
Okay, so now I'm going to have Dr. Lauck come in here, and she's going to do her examination. It's all for sleep, to show, you know, what sleep apnea does to your teeth and your gums and everything. And then she's going to take a bite registration for us, which will go to the lab to have the appliance made directly for you.
Right.
Okay?
Can I brush my teeth?
No, not yet. No, she's going to put material on here just like I did,
Oh, okay.
and save you a trip. But I promise you will be able to brush your teeth in just a moment. Let me get her in here. All right, got everything for
for me?
Yes, ma'am. I've got the impressions right here.
And we were talking about doing a salmonid appliance.
A dorsal.
Yes.
Okay.
You're leaving us with a good impression. Yeah, that looks fine. Okay.
Here's his pano.
Oh, we got some wisdom teeth in there. I think we'll leave them alone.
Yeah. I'm not willing to take them out.
And here's his
I only have
airway.
the top ones. I wasn't one that bottom.
You're lucky there.
Let me change the color on that just a little bit.
Yeah, that's a very narrow airway.
I'm gonna bring it
There's,
around
like,
to the front so
nothing
she can
there.
show you there, Joe.
We look for this dark space right here and it just disappears. So it's very narrow, and that's probably why your airway can collapse so easily when you're laying on your back. There's just not a lot to keep open. So,
And we'll look at the tomo.
okay, and another thing that I see in this is your jawbone, and this spot right there is your ear. That jawbone usually sits farther forward like this does right here. You're probably biting on your front teeth. The reason I point that out, this space back here is usually a cushion area for our jaw, and there's a lot of blood vessels and nerves in that area. So when we have someone wear an oral appliance all night long, this space tends to fill up with fluid. It should have the fluid in there, but with your teeth squeezed together, you've squeezed all the juice out of it. So when you wake up in the morning, more than likely, you're gonna feel like only your front teeth are biting. And it's not a tooth movement or anything bad. It's just that fluid's gotta get squeezed out of there. And we've got ways to help the tissues get back to their normal place. Some people it doesn't even happen, but when I see this situation, I just like you to be aware that morning when you're, oh, what the heck happened to my teeth?
Oh, I feel
It's-
like my bone draws forward.
Uh-huh. But we have an aligner that helps get those teeth back into their normal position. So it shouldn't be a problem. Alrighty, so let's go ahead and take a look around. I'm just looking at the changes that may have happened in your airway, and plus you've had some things done to it with those. Do you still have the pillars in there? As far as you know, some people, they actually start coming out and they fall out, so that's why I ask. Okay, well, let's take a look here. Okay, we've got tori on the mandible, Christine, moderate size. And bite your teeth together. Class 1 occlusion on the right, class 1 occlusion on the left. Midlines match, and we need to note that there's a millimeter diastema between 8 and 9, 3 millimeter over bite, and a 2 millimeter over jet. Okay, and open again. Tongue is fissured and above the occlusal plane and protruded into the airway. She left some material on it too. Okay, and open real big again. Normal size palate. Stick your tongue out and say ah. Okay, you can relax and close. Our malum patty is a 3. Inflamed, soft palate and elongated uvula. And our nares is within normal.
Tonsils.
I couldn't see far enough back there. Do you still have your tonsils?
I when I had those pillars done,
Uh-huh.
he said that he could offer a laser reduction of the tonsils, but he said mine were not enlarged,
Didn't need it.
which I wanted it anyway, but I used to get tonsillitis all the time.
Well, usually when we get a little bit older in our young years, so like 8, 10, 12, our tonsils will shrink back. But as little kids, we can have all kinds of tonsil issues, but it's normal for them to to shrink back. So that's
Oh.
probably what occurred for you. He did have turbinate surgery, and there's pillars that have been placed.
Turbinate, yeah, 'cause,
Okay, I'm gonna just check a bite here. Bring your teeth together and slide your bottom jaw forward as far as you can go. Oh, that's not loose. There you go. Okay, perfect. And open for me. This is just giving a range for the lab. I'm not going to have your jaw that far. Not needed. Let's see here. And bite your teeth together. And open for me. And bite down. Good. Any discomfort back here? Okay, good. And open. Okay. We're gonna take an impression of that. Okay. All right, and open, and bite down, and just hold that. And you've gotten off naked there. I'm gonna redo it. Okay, and open. Try this again. Bite your teeth together and open. Bite your teeth together and open for me. Some people like to try and help me, so I gotta force the teeth into a certain position. What kind of work do you do?
in sales,
Sales? Sales of what?
electrical products.
Oh, I've got some very good friends who do that with Rexel.
But yeah, they're one of my customers.
Oh yeah? I ride a motorcycle and
Oh yeah,
we ride with them.
Rexel on this side for Fort Worth. Or
In
Carrollton.
Carrollton. Okay, bite down. You know who that is? Danny and Greg.
Oh
I
yeah.
think you've met Kelly.
No, I've not met Kelly. I've only Danny Smith and Greg.
Hooch.
I can't pronounce it correctly. My buddy.
Okay, and open. Good. Okay, perfect. You need a range of motion, or did you
Yes,
get
ma'am.
one?
Now I need a range of motion.
Okay. One more thing, and then I'll be done. Okay, and open as wide as you can. Go to 55 and bite down. Bring your jaw as far as you can towards my finger to the side. As far as you can go. Good. We go 8 to the left in the other direction. And 10 to the right, and then out again like a bulldog. Then we protrude 7. Very good.
Okay.
That's all good range of motion, which helps with an appliance. Okay, so we'll send this off to a lab and have them make it. It usually takes between 2 and 3 weeks. And we'll give you a call to set up an appointment when it comes in, so that we've had 1 or 2 appliances get stuck in
Customs.
mail somewhere.
Yeah.
Yeah, so you want
Oh,
to
so
sure.
I'm gonna let you brush and floss, and then I'm gonna take some photographs of your teeth. Okay?
Okay.
Right over here. So I have some floss right here, and a toothbrush for you. And then some toothpaste. When you're done with your toothbrush, you can place it right in here and use it your normally. The gloss here. Yeah. Okay, so I'm gonna have you just stand right here in front of me. I'm gonna take a quick photograph. There you go. You can smile if you like. All right, have a seat right there. The reason why I take those photographs is because it helps the doctor whenever she's looking through your chart to see your face. She can look at your teeth and know exactly who you are. But if you show her a face photo, it's just perfect. All right, so I'm gonna give you some chapstick here because I'm gonna put some cheek retractors. Have you seen that game, Big Mouth? You put these cheek retractors in, and it stretches out everything.
Yes, no, those.
Okay, so I'm gonna place those in, and if you'll place that in the corner of your mouth so I don't stretch out your lips and just mess them up. That's a brand new chapstick for you.
Oh, we'll just put this on my lip.
Yeah, so I don't chop them up and stretch them out too much. Perfect, and now that is yours. Some cheek retractors, open for me. Wonderful. Close down for me. Perfect. So I want you to stay biting down like you are. Here we're going to take these photographs. Now there's going to be a bright flash, so if you want to close your eyes, go right ahead. I don't blame you. Waiting for the flash to turn on. There we go. Okay, what I want you to do is open slightly. There you go. Gotta have the flash there. All right, so oop, tap. No, tap. Oop. She said take the whole thing. Okay, so I'm gonna use a mirror to take pictures of the tops of your teeth. You open for me? There you go, perfect. Tilt your head back. Perfect. If you'll close down just a little bit, that way I can see the tops of your front teeth. There we go. Oh, once again, ahead of flash. Close down a little bit more. There you go. All right, now bite down for me. Tilt your head back for me. All right, stay like you are. I give up. All right, we are done. Yay! So it should take us about a week or two before we get it back from the lab.
Okay.
Okay?
Yep.
Come on this way. Sure, definitely. Have a seat right there. I'll give.